Thank you for joining me. This is my first ever internet communication on subjects like this that are so important, and today I'm going to speak for just a moment about the health care debate in Congress. One of the reasons, and I think the overriding reason, that we need to continue working together to try to find common ground on this issue is that the health care system in America must be reformed because of the cost, not just to the government, to the taxpayer, but to families and businesses. Our current system, which is about half of our people being covered through a public system and half of our citizens being covered by a private system, is just too expensive. It is moving, we must move that cost curve in a different direction. And so cost is a very important factor. The second important factor is I believe that Americans, whether you're an individual, a family, or a business, should have stability and should have confidence in the system that they're in. Again, whether it's public or private. Stable, something you can count on. That is not the case today. And just a few statistics that prove that are the following. Half of all working Americans don't have health care they can count on, which means 52% of Americans age 18 to 64 have experienced what we call a gap in their health care. They either have pre-existing conditions, 46 million Americans, such as diabetes or heart problems, which make it harder or extremely expensive for them to get coverage. 37 million, as I said, had a gap in their insurance, which means sometime in the last year they lost their coverage or were grossly underinsured for a portion of last year. 20 million Americans skipped a doctor's visit due to cost. So a pre-existing condition does not have to be a serious disease like cancer or heart disease. Even minor conditions like hay fever, asthma, or previous sports injury can trigger higher premiums or absolute denial in coverage. This is not fair. This must be changed. In one survey, 1 in 10 people with cancer said they could not obtain any health coverage, and 6% said they lost their coverage because of being diagnosed with the disease. I'm hoping that we can work in Congress to fix the insurance market, so that insurance companies cannot drop individuals with pre-existing conditions or with other situations that would cause their premiums to increase. So there are a tremendous amount of cost associated with the current situation, as well as, dozens of aspects of it that cause people to not have confidence in their system. So what we're trying to do is work in a bipartisan fashion to shape a response to these particular issues. And one other point that I wanted to make today is that one of the most important things is to try to provide less expensive coverage to businesses. The insurance cost to small businesses in America has quadrupled in the last 15 years. And at that rate, many small businesses, and there are 27 million in the country, will really struggle in the years ahead to provide the kind of coverage that they want for themselves and their employees. And if we don't try to provide opportunities for small businesses to get health insurance, then that will cause them not to be able to hire the kind of employees they need to grow, and will cause us to be even less efficient than we are in creating the jobs necessary to pull us out of this recession. So for the reasons of cost to the government, to the taxpayer, to businesses, to families, the fact that our small businesses are going to lead us out of this recession, our work in Washington on health care reform is important. So let's stay focused the next couple of weeks and months to see if we can find common ground to reform the system of health care so necessary in America today. Thank you so much for listening. If you have any comments or want to be in touch with our office, please contact us through our email, through our telephone address, which will come up after this is over. Thank you so much. I appreciate it.